Rationale of the National Health Policy. In order to bring about improvement in the present health conditions of the Nepalese people adversely affected by the previous weaknesses and to fulfill the commitment of the present government in the health sector, it is necessary to have a new health policy. Objectives of the health policy. The primary objectives of the proposed health policy are to upgrade the health standards of the majority of the rural population by extending basic primary health services up to the village level and to provide the opportunity to the rural people to enable them to obtain the benefits of modern medical facilities by making the facilities accessible to them. Targets of the health policy. By the year 2000 AD, the following targets will be attained. 1. The infant mortality rate will be reduced to 50 per 1,000 from the present 107 per 1,000. 2. The mortality rate of children below 5 years will be reduced to 70 per 1,000 from the present 197 per 1,000. 3. The total fertility rate will be reduced to 4 from the present 5.8. 4. The maternal mortality rate will be reduced to 4 per 1,000 from the present 8.5 per 1,000. 5. The average life expectancy will be raised to 65 years from the present 53 years. Proposed health policy. 1. Preventative health services. The services that are provided for the prevention of diseases fall under the preventative health services. Under these, priority will be given to those programs which directly help reduce infant and child mortality rates. These services will be provided in an integrated way through sub-healthcare centers at the rural level. The main programs under this service are as follows. 1. Family planning and maternal and child health. 2. Expanded immunization. 3. Safe motherhood. 4. Diarrhea and acute respiratory infection control. 5. Tuberculosis control. 6. Leprosy control. 7. Malaria and Kala-Azar control. 8. Control and prevention of communicable diseases. 9. Initiation of prevention of non-communicable diseases. 10. Initiation of primary health services in urban slums. 11. Prevention and control of AIDS. 2. Promotive health services. The programs which enable persons in communities to live healthy lives are included under promotive services. 1. Health education and information. One of the main reasons for the low health standards of the people is the lack of public awareness of health matters. Therefore, health education will be provided in an effective manner from center to rural levels. For this, political workers, teachers, students, social organizations, women, and rural volunteers will be mobilized extensively up to the ward level. 2. Nutrition. Priority programs will be promotion of breastfeeding, growth monitoring, prevention of iodine deficiency disorders, iron and vitamin A deficiency, and health education to enable mothers to meet the daily requirements of children through locally available resources. 3. Environmental health. Programs to inform the people about personal hygiene through various media, to collect and manage solid wastes, to inspect and examine hotel foods, drinking water and other edible products, to manage construction of general latrines and urinals will be initiated in a coordinated manner. 3. Curative health services. The following curative health services will be made available at central, district, and village levels. 1. Preventative, promotive, and curative health services will be made available in an integrated way in the rural areas through sub-health posts, and primary health care centers. 2. There will be at least one hospital in each district of the kingdom where outdoor services, indoor services, family planning and maternity and child health services, immunization services, and emergency services will be provided. 3. One zonal hospital will be established gradually in each of the zones of the kingdom. Specialized services relating to pediatrics, gynecology, general surgery, general medicine, eye care will be available. 4. One regional hospital will be established gradually in each of 5 regions of the kingdom. In these hospitals, specialized services e.g. dermatology, orthopedics, and psychiatry will be added in addition to those available in zonal hospitals. 5. The central hospital will be equipped with sophisticated diagnostic and other facilities and provide specialty and super specialty services. 6. Specialist services will be extended to remote mountain regions as and when required through mobile teams. 7. A referral system will be developed through which the rural population will be provided with the opportunity to obtain services from modern, well-equipped hospitals as and when required. 8. Diagnostic services e.g. laboratory, X-ray, and other supportive services will be strengthened in the hospitals at all levels. 9. Hospital expansion will be done on the basis of population density and patient load. 4. Basic primary health services. 1. Sub-health posts will be established in a phased manner in all Village Development Committee areas of the kingdom. Each sub-health post will employ 1 village health worker, 1 maternal and child health worker, and 1 auxiliary health worker. These sub-health posts will provide general curative, promotive, and preventative health services, immunization, family planning, maternity and child health, health education, nutrition, environmental education, sanitation, and treatment of malaria, leprosy, and tuberculosis will be extended by these sub-health posts up to the ward level. 2. 1 health post in 205 electoral constituencies of the kingdom will be upgraded in a gradual manner and converted to a primary health care center. In addition to the services as provided by sub-health posts, arrangements will be made for 2 emergency beds and 1 maternity bed in these centers. 3. The health posts operating at present will provide all health services in the Village Development Committee where they are located as done by sub-health posts, and also provide training for and supervise and monitor the activities of sub-health posts. 4. Community participation in health services. Community involvement will be sought at each level of healthcare. Participation of women volunteers, traditional birth attendants, Sudanese, and local leaders of various social organizations will be mobilized for health programs at ward levels. 5. Organization and management. Improvements will be made in the organization and management of health facilities at central, regional, and district levels. Hospitals and public health offices at district levels will be operated in an integrated way under one organization. The technical and administrative supervision and follow-up system for health organizations at various levels will be made more effective. Hospitals and health units at different levels will be classified. A detailed description of the services available at the health facilities at different levels, the cost of the services, and list of free services will be made public and prepared. The collection, compilation, recording, and reporting systems for health information at each level will be made more effective. Improvements will be made in transportation and support systems for drugs and equipment at various health facilities. 7. Development and management of health manpower. 1. Capable manpower required for various health facilities will be developed in a planned manner. 2. Necessary cooperation will be extended for institutional development of the Institute of Medicine, the main organization of the country producing health manpower, in order to raise its production capacity as required. 3. Necessary arrangements for training in foreign countries will be made in order to produce those categories of manpower which cannot be produced within the country. 4. The training centers under the Ministry of Health will be strengthened institutionally and their production capacity will be raised as required. 5. Necessary reforms will be made in transfer, promotion, and career development procedures for the health personnel at various levels. 6. Arrangements will be made for special benefits for doctors and other health personnel to encourage them to work in remote rural areas. 8. Private, non-governmental, and intersectoral coordination. E. If someone in the private sector wants to extend health services through the establishment of hospitals, health units, nursing homes, without any financial liability to His Majesty's government, such institutions may be operated after having obtained necessary permission from His Majesty's government and subject to minimum standards as prescribed. 2. Non-governmental organizations and associations will be encouraged to provide health services under the prescribed policies of His Majesty's government. 3. Necessary coordination will be maintained at each level with the health-related sectors, including agriculture, education, drinking water, and local development. 9. Ayurveda and other traditional health systems. The Ayurveda system will be developed gradually in a phased manner. Organizational structures for different levels